polyuria in children, it is termed as the urine output. The urine output is more than 5 to 6 ml per kg per hour. It is termed as a polyuria. So when the case of polyuria comes in, we have to check the blood glucose. We have to check the blood glucose. The fasting glucose FBS is more than 126 milligram per deciliter, and also the RBS is more than 200 milligram per deciliter. It is termed as diabetes mellitus. And the next step, we have to check the venous blood gas, and also the sodium and potassium need to be checked. So one situation, if potassiums are low and serum chlorides are high, it is termed as normal anion gap metabolic acidosis, which is seen in venotubular acidosis. And the second situation, if serum potassiums are low and also the serum chlorides are low, it is termed as metabolic alkalosis, which is seen in the Bartter and the Gitelman syndrome. Bartter and the Gitelman syndrome. So what are the difference between the two? So the Bartter syndrome, it is a severe form and seen in the infancy. Here the patient have the hypercalciuria, which will lead to the nephrocalcinosis. So the mother is having the antenatal polyhydramnios. So treatment, we have to give the indomethacin. It will decreases the prostaglandins because the Bartter syndrome occurs due to the high levels of the prostaglandins. This indomethacin will decreases the prostaglandin. Along with that, we have to give the sodium plus chloride supplements. On the other hand, we are having this Gitelman syndrome. Gitelman syndrome, it is a mild form. It is seen in the adolescent and child, and the child is well thriving. Here the serum magnesiums are low in the 100% cases, and this will causes a low calcium excretion. This is known as hypocalciuria. So next situation, here we have these potassiums and chlorides are normal. So we have this psychogenic or diabetes insipidus. How to differentiate between the psychogenic and diabetes insipidus? Psychogenic diabetes insipidus. So water deprivation test. Diagnosis is by the water deprivation test. So here the osmolarity, urine osmolarity will be increased in the psychogenic patients. Diabetes insipidus, we have two types of diabetes insipidus. One, it is the central, and other it is the nephrogenic. The central diabetes insipidus, here the vasopressin is low. Whereas nephrogenic, it is an X-linked recessive condition. It is more commonly seen in the males. So in the nephrogenic diabetes insipidus, it is a vasopressin receptor zone work. So diagnosis is by the vasopressin challenge test. So central diabetes insipidus will respond to the vasopressin challenge test.